is the heartbeat of any society. For decades, Cross River State longed for a health system that truly served its people. In the last 2 years, under the People First leadership of Governor Bassey Otu, that longing has begun to turn into reality. At the center of this transformation is Dr. Henry Otu, Commissioner for Health, who is leading the Otu-led administration's charge for a viral, modern, and accessible health system.
I want to thank God for His Excellency, my dear friend, the Governor of this state, who picked me from the sheepfold and gave me a chance to serve, to prove what God has for everybody. You could see that for these 2 years, His Excellency has done so much, and I dedicate this anniversary to him totally, because whatever is happening in the field today, he is the one that has done so. He is the one that has given that enablement.
When Governor Otu assumed office in 2023, his People First agenda placed health at the core of governance. The mandate was clear: restore confidence in the system, expand access, and strengthen delivery. Dr. Otu, backed by a team of qualified and dedicated colleagues across the health value chain, has taken that mandate with vigor.
He is the pragmatic leader. We believe that all that we have achieved in these 2 years and in the next years that's coming, we'll be able to achieve more, and we're able to take Cross River State health sector to the level where God has destined for us.
The map of healthcare in Cross River is being redrawn. Secondary health facilities are rising where none existed. Primary health centers are being upgraded into functional cottage hospitals, and through sustainable partnerships with the World Bank,
He has done a lot to uplift the primary health centers, the secondary facilities, and is doing a lot to ensure that referral hospitals too come on board to make sure that from the primary aspect to the secondary aspect to the tertiary aspects, residents of Cross River State would have an unimpeded access to quality healthcare.
the Impact Project is revitalizing 82 primary health centers across the state, bringing quality healthcare closer to the grassroots.
Impact is immunization plus and malaria progress by accelerating coverage and transformation. It is a very, very unique project that have come to Cross River State to assist the people, especially in the rural areas. Impact has two components, the malaria and the immunization component. Cross River State is more into the immunization component. That doesn't mean Cross River State is not taking care of other malaria incidences in the primary healthcare centers. One of the major strives of Impact Project is to ensure the revitalization of some selected primary healthcare facilities. In this phase, the Impact Project, in collaboration with the basic healthcare facilities, are revitalizing a total of 96 health facilities in the state to upgrade it from level 1 to a level 2 facilities where people can actually have access and have good access to healthcare. Impact has also supported service delivery in the primary healthcare centers. Within the primary healthcare centers, the Impact Project have engaged 196 skill-based attendants who are currently aiding in delivery in the 196 wards of Cross River State. Our data from the primary healthcare have been digitalized by providing 196 laptops across the 196 wards to be able to get first-hand information from the wards and then transmit it into the DHIS2 database. That is the Health Management Information System.
Couple of things. First, I appreciate the governor for his commitment to the welfare and the health of Cross Riverians. The good thing that is happening is really a demonstration of his commitment to the health of his people. I must commend him because originally Cross River was not part of the Impact Project. they became part of the Impact project under his leadership. He expressed interest and they were added to it, and what we are seeing today is a manifestation of that. I visited some of the facilities that they are renovating, and I'm okay with what I'm seeing. The whole idea is to take facilities from level 1 to level 2. By that we mean we have standard POCs that provide quality healthcare to Nigerians and of course to Cross-Riverians, and I'm impressed with what I've seen so far.
Innovation is powering the new health agenda. At Ndo, Ogoja, zipline drones deliver life-saving drugs to hard-to-reach areas. With Elephant Health Services, digital information management is being rolled out, modernizing patient records, improving accountability, and boosting efficiency. In Ogoja General Hospital, a new medical oxygen plant ensures a steady supply of this critical commodity.
In COVID-19 era, we had the misfortune of people dying because there was no oxygen. So now we have oxygen. We have oxygen in General Hospital, Calabar. We have oxygen in General Hospital, Ogoja. And then there is the one being built at Comprehensive Healthcare Center in Ikom being finalized. So very soon we will not have need to cry out for oxygen because it will be available to all the citizenry.
A hospital means little if people cannot afford care. To solve this, Governor Otu launched the Health Palliative Program, a groundbreaking model that provides free medical services for pregnant women, children under the age of 5, and citizens over 70. From Yarasang to Bendegekem, families are already benefiting from this lifeline.
If you don't have healthy human beings, you don't have a community, you don't have a nation. So we set out to make sure that our health, the health of our citizens, is going to be top-notch in our agenda. What we have done is to make sure that we reduce the rate of not just infant mortality, but also adult mortality.
And this is what he has done to improve access to the vulnerable populations, to the unreachable. So we did outreach services in rural areas that ordinarily will not have access to surgeries and so forth. We did all those things. And that is a primary area in which he carries out his work. We launched out his very important program, his flagship program in the health sector, which is the Health Palliative Program. If you go to Nyansa Medical Health Center, you see what it means. That structure is a superstructure, it's a primary healthcare structure, but entirely built and institutionalized by His Excellency. You go there, you have free medical services for pregnant women, children under 5, and the elderly above 70. There is an ambulance service. That facility has 24 hours service delivery. There is a staff quarter, and there is a doctor there, 24 hours staying there. There is also a midwife. That is what His Excellency is doing primarily, and we are putting that kind of a model, one in each local government.
Today, Marakpan Mimi 219. So the place is getting them. But if you're 2024, everywhere is good. Even the road on Amde, everywhere the okay, sir. You don't have a young fee. But people need to be made, you don't have a young fee.
I am Augustine Nakam. I'm 70. I was suffering from high knee. You operated me successfully. You have done marvelous. I cannot be able to express myself for this.
At the same time, the state has employed over 500 new health workers across both secondary and primary health facilities, strengthening manpower and ensuring no communities left behind. Cross River's health insurance scheme is also expanding from the formal to the informal sector, ensuring that artisans, farmers, and traders are covered. One of the strongest advocates is Her Excellency Bishop Gov Bassey Otu, wife of the governor of Cross River State, through her health outreaches, humanitarian programs, and adoption of enrollees, she has become a beacon of hope in the health sector.
You know, His Excellency was a member of the governing board of NHIA before he became governor. So he understands clearly the importance of health insurance, and that's why he's so passionate about this and is bringing it. The Commissioner for Health too understands it. He has been very long in the development world, in the health financing landscape. So he came with his robust idea to ensure that these things are well achieved. And by so doing, partners are becoming interested to come and join us. A partner has been procured to work with us in this office to ensure that we bring in more people from the informal sector into the scheme. You know, it is easier to enthrone the formal sector, which is civil servants, and then the vulnerable group, which is out there. But the informal sector forms about 90% of the nucleus of this succeeding. So the government has just procured a partner to come, be with us, partnership with us, to ensure that the greater number that is out there, the organized private sector, the market women, the NURTW, school children, all come into the scheme. We have just signed the MOU and we're about to roll out. The formal sector equity funding, the civil servants pay 10%, the state government pays the other percentage. That one is being rolled out, and very soon we will have a very robust health insurance to be rolled out.
To mark 2 years of service delivery, the Ministry of Health rolled out a week of impact, medical outreaches, inaugurations, and project tour across all senatorial districts. One of the most symbolic milestones was the acquisition of a permanent office for the State Agency for the Control of AIDS after 30 years without a home. With this, Cross River's fight against HIV/AIDS gains new strength and coordination.
Our indigenes, dwellers, settlers in the Central Senatorial District will have first-hand medical care without having to risk emergency cases of driving to Calabar, sometimes 4 hours, sometimes 6 hours to get to the General Hospital Calabar. This means taking healthcare to the doorpost, the doorstep of the people in the Central Senatorial District.
When I came in here, there was no space for us to sit down and do our work. But now that this office is being commissioned today, we are very, very excited. We are happy. Our partners are going to be coming again because we've been having calls from left, right, and center. They want to come and have meetings with us. Now, by the time when I came in, it was a very shameful atmosphere for anybody to hold any meeting. But today, we have an office. We are happy. We thank His Excellency very seriously for being so supportive and being so visionary as far as the human mantra of his administration is concerned. We have done a lot in the health sector, and we are excited, we are happy. Now, when the people are happy and the people are healthy, then the productivity will increase.
For his dedication to ensure that we provide quality healthcare services to the people. You will not be able to achieve this in an environment that is untidy, in a building that is not attractive. He has demonstrated that by giving approval for this facility to be upgraded. We've gone round, we've seen what is happening here. This place was an eyesore a few years ago, and today is attractive enough to even draw partners, and even those that are coming here for services will have satisfaction that they are in the right place.
Every reform is ultimately about the people. Patients would no longer need to travel outside the state for dialysis. Nursing students are learning with modern tools. Mothers give birth in a safer environment. Behind every project, there are lives changed and hope restored.
We have a referral ambulance system for relief management. An ambulance is not to carry corpses. An ambulance is to carry people who are at the risk of dying so that they won't die, so that they can be referred to nearby hospitals or centers where they can be treated.
Equally not relenting is the great support being given to His Excellency by his wife, Bishop, Her Excellency Bishop Dr. Mrs. Gov Bassey Otu. Recently, she enrolled 500 aged people into the health insurance. That was not enough. She added an additional 100, making 600. And as I speak with you, she is ready to bankroll the enrollment of HIV positive people into the scheme. What the husband is doing, she is complementing. And it's a thing Perseverance should rise up and appreciate. Gradually, we're moving there. Recently, His Excellency too has approved the CONMES, that is the doctor's salary, to rank with that being given in any teaching hospital in Nigeria, so that the doctors will find Cross River State attractive to work in our facilities. That is a major boost for the health sector.
2 years on, Cross River's health sector is on a new path, with more hospitals scheduled for upgrades, with digital system expanding and health palliatives providing free care to the most vulnerable, and with donor partnerships deepening. The state is positioning itself as a model for Nigeria. Governor Bassey Otu's People First vision, driven through the oversight of Dr. Henry Egbeayok, is providing that with leadership, commitment, and compassion. A healthy Cross River is not a dream, but a reality in motion.